In 1986, only 3 blocks south of here, 9 parents were brought together by the tragedy of childhood lead poisoning. These children were poisoned in their own home from peeling, chipping, flaking paint that in the long run had a major impact on their school performance and on the trajectory of their lives. They formed Parents Against Lead, and out of that, the Green and Healthy Homes Initiative was born. Over the last 30 years, GHHI has been committed to the fact that no child should be brought up in a housing condition that will undermine their ability to read, undermine their ability to breathe, undermine their ability to reach their full potential. Working with partners throughout Baltimore and around the country, we've delivered meaningful results. In Maryland, we've reduced childhood lead poisoning by 98%. We've also reduced emergency department visits and hospitalizations by 65% for children with asthma by improving the conditions in their home. Our goal is to ensure that education funders, healthcare funders, and all of us who care about the trajectory of our children and the health of our neighborhoods will come together behind the mission of healthy housing in America.
Before 2007, Akil had frequent visits to the hospital where he was hospitalized for weeks at a time. And at the time I was working with another nonprofit agency, and when you did not work, you did not get paid. So it impacted my family financially. Healthy Homes came in to provide that education. His visits are less frequent. He participates in a lot of different sports. He's learning how to manage his own asthma and can communicate when he needs his medication. So when they came in and explained to me, okay, we gotta test the window sills and the floors and the porch, I was like, for what? You know, and they came in and really explained to me the why. And they were professional, efficient, they respected my home. I thought that you get lead poisoning for eating paint. And I didn't realize that it's the dust that the children inhale and causes the lead deficiencies. My experience with Healthy Homes have been great. It has really changed the trajectory of my son's life.
The thing I really love about GHHI is the fact that it scales. What's really great about it and what I think kind of sets it apart is the fact that instead of just delivering services here in Baltimore, we've found a way to get that into cities all across the country and not just locally.
We work on so many different levels. We work directly with families here in Maryland. We work with cities around the country, and we also work with federal agencies, outside funding, and so I find it really dynamic to be able to have these different conversations with so many different stakeholders and be able to take lessons learned from around the country and apply them to national policy issues. Social innovation financing, or pay for success, is a new model in the United States where you bring in outside investors to pay for social services, and then you track whether or not those social services lead to outcomes. And if those outcomes are met, and only if those outcomes are met, then government pays on the back end.
We need to invest in the future health of our children and the vitality of our communities. And GHHI is helping to pioneer ways that healthcare systems and state Medicaid programs can both pay for prevention and save money by doing so.
I think that if we could replicate what GHHI is doing from a federal perspective, not only will we have better health outcomes, better housing outcomes, we will house more people, we will also reduce the cost it takes to provide those services and have then funding to do more.
I think every day what keeps me excited is the impact that we see. It's really important whether we're in our Jackson, Mississippi office or in our Providence, Rhode Island office or in Maine or in California or in Washington. Each of those offices that we have are there strategically to make an impact. What drives me every day is the results. Watching the lead poisoning rates come down, reducing asthma admissions to hospitals, and to see families who literally, the ability to sleep through the night and get to work and kids get to school, it is transformative when you can have a part in helping to make that happen for millions of families across America. We're here because in the end, what we're trying to do is to create healthier housing in America so that kids are not lead poisoned and have the ability to succeed in the classroom, to read better, to earn more in their lifetime, and to actually reduce the incidence of asthma that rob children from the ability to even get to school. So in the end, what we are really about is improving housing to improve health outcomes, educational outcomes, and social outcomes so that every child in America can reach their full potential.